Hello and welcome to the Daily Aus. I'm Emma Gillespie.
I'm Sam Koslowski.
Health experts have joined forces to call on the government to introduce national legislation that would make it illegal to give birth without a doctor or midwife present. It comes after several recent deaths linked to a practice known as freebirth. Today, we are going to explain what that means, where this push for regulation has come from, and what experts, advocates, and lawmakers are saying about it.
And this is a really interesting story. It's been in the headlines for the last couple of weeks and well due for an explainer on it. Before we get into the details, though, of what health experts are calling for, can you explain what freebirth actually means?
Yeah, so a freebirth is the intentional practice of giving birth without a registered healthcare professional, like a midwife or a doctor, present. So it's a birth outside of a traditional maternity context.
Right.
It might happen at home, but a freebirth is different from a home birth. That's a really important distinction to make. A home birth is a planned birth at home with a registered healthcare provider. So just to be really clear, home birth involves a qualified midwife or doctor attending the birth at someone's home, whereas a free birth is when someone chooses to give birth without any registered medical professional at all.
And give me a sense of how common free births are in Australia at the moment.
Well, they aren't tracked nationally, which makes it hard.
That makes it tricky.
Yeah, to put an exact number on it. But the peak bodies for obstetricians and midwives, as well as various state-specific health bodies, say that there has been an increase in free births, particularly since COVID-19. What we do know is that they are rare. 97% of births in Australia happen in hospitals.
Wow, okay, so between free births and home births, we're talking about a general pool of about 3%.
Yes, exactly. Okay. But there is a lot of nuance within that 3%, you could say.
Yeah.
The latest available national data shows that there was a 130% increase in home births between 2019 and 2023.
Interesting.
Again, home births, not free births. And an average of 14% of those required a mid-birth hospital transfer. So something happened, something went wrong, there was some medical complication. As I mentioned, though, this doesn't include free births, but I think those numbers on the popularity and risk levels of home births give us a bit of an insight into the kind of non-traditional birthing options in Australia and the interest or growing interest in them.
And so talk me through some of the risks that experts say are associated with free births, so those unassisted births at home.
Yeah, these are considered the highest risk environments to give birth, and according to the Department of Health, free birth can increase the chance of multiple health problems for both mother and baby, with risks including excessive bleeding, tearing, complications if the baby doesn't start breathing, including long-term health issues or even death. Without a midwife or doctor present, birth complications and specific emergency challenges can go undetected.
Right.
That is really critical. What may seem okay in 1 minute may turn into something that is extremely dangerous the next.
Or even a couple of hours later.
Well, exactly. Hours or days later. The World Health Organization states that around 15% of all pregnant women will develop a potentially life-threatening complication that calls for skilled care. Some will require major intervention to survive. And of course, that intervention is only possible with medical professional care. Tragically, we have seen several deaths linked to free births. A 2024 ABC investigation identified 7 babies and 1 mother who died during or after free births across parts of New South Wales and Queensland in the space of 18 months.
So we know what can go wrong in a free birth context, but I think it's important to understand why someone would choose that path. What data or research is there around why people would pick a free birth route?
Yeah, absolutely. I think it is really important to mention that this is an incredibly personal decision for a lot of expectant mothers and families. There are a lot of opinions in this space and, ultimately practitioners want there to be some level of choice, but they want those choices to be prioritizing the safety of babies and expectant mothers. According to health experts, though, many women choose free birth after experiencing a previous traumatic birth in hospital. So research does show around 1 in 3 Australian women do experience birth trauma, and some of those women end up finding the hospital environment, overly clinical. They feel they don't have autonomy over their own bodies during childbirth. They're left with physical or psychological scars that lead them to consider non-traditional options for birth. There was a New South Wales inquiry into birth trauma that received thousands of submissions, mostly from mothers who said they were ignored, belittled, denied the opportunity to give informed consent to certain procedures or medications. So that paints a bit of a picture as to the why. And cost is also a major factor. Publicly funded home birth programs do exist, but they're not widely available. There are limited spots, and that might lead some families to consider free births as well.
And what you're alluding to there, it sounds like, is the idea that there are some systemic issues in the maternity system that are driving some of these choices, right?
Exactly. And many experts, including some midwives, doulas, they argue that this rise in free births is exactly what you've said, Sam, a sort of a symptom of a broken system. So the Australian College of Midwives has said that while they don't support free birth, they do support home birth with qualified professionals, and they respect a woman's choice. If a woman chooses free birth and then requires care, they should receive non-judgmental care.
And one of the words you mentioned just then is worth talking about in itself, a doula. Can you classify what a doula is and how they fit into this discussion?
Hi, I'm Zara. I'm the co-founder of the Daily Aus, and we started this company because we think news can be done differently. If you agree, you can hit subscribe. It's the best way to help us grow. Now, back to the video.
Yeah, so the free birth discussion is not one you can have without talking about doulas, I don't think. This is a birth support person who's essentially contracted by families privately, and they provide emotional, physical, informational support to someone during pregnancy, during labor itself, and after birth. But doulas are not medical professionals. They're not trained to provide clinical care or to respond to medical emergencies. Some doulas around the country are members of various health bodies that have their own mandatory codes of conduct and ethics. But the doula industry is by and large an unregulated one. There is no mandatory accreditation to call yourself a doula and to sell your services to expectant families.
So let me just kind of take stock of where we are. We have a system in Australia where largely women are giving birth in a hospital setting, and at home there's home births and free births. The big difference being if there's a registered professional in attendance or not.
Exactly.
Why are we talking about this on the podcast today with all of that context in mind?
Yeah, so that increase in free births and also in complications has prompted calls from two peak bodies within medicine. We've got the Royal Australian and New Zealand College of Obstetricians and Gynecologists.
Or RANZCOG.
Yep, RANZCOG is what I will call them from now. And the Australian College of Midwives. They have released a joint statement calling on the government to overhaul birthing outside of the system. That's another term you hear talking about free births. They want legislation to ban free births and to regulate this space. And one of the most recent high-profile cases leading up to this moment, you may have seen online some commentary about this. It involved an Aussie nutritionist and wellness influencer. Her name was Stacey Hatfield. She gave birth at home to her first child in September. She was transferred to hospital shortly after the birth due to an unforeseen and extremely rare complication, according to her husband, where she later died. So that kind of follows this groundswell of interest, conversation about this kind of maternity care in Australia, and is really kind of the driving force behind this latest wave of conversation.
I've definitely seen more conversations about this play out in media, probably since the end of the pandemic, where this trend really did start to emerge, but it's clear we're talking about it today because of those comments. What did the health experts call for, and what did they propose in a bit more detail?
Yeah, so that statement from RANZCOG and the Australian College of Midwives has urged federal, state and territory health ministers to, 1, introduce and pass legislation which, quote, expressly restricts labour and birth management to appropriately trained registered practitioners. That is, obstetricians and gynecologists, GPs, midwives. They also want a ban on unlicensed or unregulated practitioners from undertaking the management of labour and birth. That would include doulas. They want regulatory frameworks across all states and territories to be aligned.
So a national system there.
Exactly, to ensure that women receive the same protections, the same level of care, regardless of where they're giving birth. And 4, they want, quote, transparency, accountability and safety in birthing services to be promoted. In their statement, the groups said that while choice and model of care are important, such choice must operate within frameworks that ensure safety, quality and accountability.
So they're not calling for the end of home births specifically. They're calling for the end of free births and a doula being allowed to practice in Australia.
Yeah, well, I mean, under this framework, doulas could still practice, but they couldn't be the person that is calling the shots in a home birth. A registered, qualified doctor or health professional would need to be present as well as a doula.
And are there any states where this type of scheme is currently being already enforced?
Yeah, we actually have an example with South Australia. This is the only state or territory with legislation like this, but it is a criminal offence there for anyone unqualified to provide clinical care during labour or childbirth. This has been the case in South Australia for more than a decade. So they introduced that legislation in 2014, and that followed a coronial inquiry into the deaths of 3 babies who each died separately after complications during home births.
And just to tease out that nuance there, because I think it's really important. So that South Australian law, correct me if I'm wrong, but is that saying that a doula can still be at a birth, just not delivering clinical care, which would mean kind of leading the way in which the birth plays out? Is that
exactly
kind of right? So it's not saying that doulas can't be involved.
Yeah, none of these conversations are about kind of dismantling the doula industry altogether. It's about saying, okay, you might want to work with a doula to support you through your pregnancy and your birth, but a qualified medical person must be in the room when you are delivering a baby.
Got it. Okay. And so one of the recommendations there was about this national system and unifying state and territory laws that will inevitably involve the federal government. Has the government said anything about an idea of a national framework?
So at the time of recording, we haven't yet heard a response from the federal government or Health Minister Mark Butler. It is, I guess, a bit confusing here because state and territories ultimately make these decisions about birth trauma and maternity care. So this really would require a bit of an overhaul of those processes and states and territories working together with the federal government to commit to changes. Some change is already underway. You know, we've got states like New South Wales where there are several recommendations being implemented relating to trauma-informed maternity care, expanded midwife access in rural areas. Queensland as well is trialling public home birth programs. So some momentum has kind of started to gain a bit more traction, but it's that uniform national conversation that these peak health bodies are calling for with urgency.
So I guess from here, and we kind of wait for a response from the federal government. We keep track of some of those state and territory activities as well, and see if there is movement in this space. I know that it can be quite a divisive topic, especially I've seen in comment sections on social media. And thank you for taking us through that in a way that makes a bit more sense.
Thank you for having me, Sam.
And that's all we've got time for you on today's episode of The Daily Aus. We're going to be back in the afternoon with some of those afternoon headlines, but until then, have a great day.